Good afternoon. Don't have a lot on the COVID front, just a couple of things I wanted to mention. We did receive a return traveler um, who was in an area where there's a Marburg virus outbreak going on. If you haven't heard of this, this is the CDC advisory that went out. This particular person was returning from Tanzania. Marburg virus, it's a hemorrhagic fever, like in the same group with Ebola. So if you would have a suspect person come in, you should follow the standing Ebola plan that you have in place for these persons. So some of the symptoms can include fever, headache, muscle and joint pain, fatigue, loss of appetite, GI symptoms, or unexplained bleeding. And it's spread through, contact with body fluids. It is not airborne. I mean, these folks need to be monitored for 21 days after their last exposure. There's no recommendation at this point for active surveillance from the health department. We just get a notification that someone's come back from this area. I did touch base with the person and just let them know if they did start having any signs and symptoms to please alert us before they proceeded to the emergency room. Um, the only other thing that I've spoke about this before with our increase in syphilis, especially congenital syphilis, and now there's a manufacturing shortage of bicillin. So we will have to start prioritizing our cases that we would treat with bicillin versus doxycycline. So, of course, pregnant women, primary cases of syphilis, but contacts for people who may have latent syphilis that we may have to move to treating those folks with doxycycline rather than bicillin until it's back in stock. Some the slides that are showing now, this is from our STD update, and it is archived. So if you're interested in looking at it, you can go to Northwest AHEC and register for the 2023 North Carolina STD update. And it's over 6 hours of continuing education for it. It has a lot of good information. Some of the startling statistics, the slide that's up there right now from 2012 until 2021, we had a 538% increase in women diagnosed with syphilis, which in turn caused an associated 4,100% increase in congenital syphilis. So in 2021, there were 1,164 women diagnosed with syphilis. 146 of them were pregnant, and it resulted in 42 infants being diagnosed with congenital syphilis. So, very important if you see pregnant women to make sure that you are testing them at the appropriate times. What's happening with a lot of these cases with the increase in substance abuse, these ladies are not getting prenatal care. So they may show up and the only test that they're getting is at delivery. And so they're missing out on getting diagnosed earlier and getting treated before these babies are actually born. So just something else to be aware of. We will be going back to Red Springs tomorrow to do that second round of skin testing for that TB case. And in the last week, we have also picked up another infant or toddler case of TB in a 13-month-old. So TB is the gift that keeps on giving in our county, unfortunately.
Yes, go right ahead.
See, can you hear Dr. Okoya? He's kind of soft
Yes,
in
I
the
can
background.
hear.
Okay, go ahead.
Yes. Yeah. So I think I was looking at some reports regarding the increase of STIs in North Carolina. Also, they reported increase in syphilis in pregnant females and also increase in congenital syphilis. I just was wondering if we've had any reports of congenital syphilis in Robeson County.
Unfortunately, we have.
Oh, really?
Yes.
Okay. All right.
And we don't always, I'm sorry.
Go ahead. I'm listening.
We don't always get these reported in a timely manner. If they don't come through the health department, syphilis is reportable just like gonorrhea and chlamydia is, but sometimes the syphilis doesn't get reported to us, it may get reported or picked up in our North Carolina electronic disease reporting system. So it goes through the state. Syphilis cases are actually investigated by state DIS. They also have a shortage in workers. And, a lot of times, again, with the substance abuse issues, trying to locate these folks, trying to get them in for treatment
Mhm.
and trying to get their partners treated, it's just creating a vicious cycle of not getting tested, not getting treated, having sex. Even if the people get treated, their partners aren't get treated, and so they get reinfected over and over again, and then we end up with these congenital syphilis cases.
Wow, interesting. All right, yeah, I just wanted to, because it's been a long time I've seen congenital syphilis. Well, thank you for that information.
You're welcome. Yeah, we were just talking back and forth about, screening your folks when they come in, if they're sexually active. And a part of a full STD screen would be the HIV and syphilis. But if the insurances aren't covering it, that's a different story. If people have risk factors or want to be tested, we do offer free testing at the health department. It happens a lot with the emergency room. People will go in requesting an STD screening, and they only screen them for gonorrhea and chlamydia, not HIV and syphilis. And they tell them to come to the health department and get their blood drawn. So it really should all be done together. But, if you can't do it, if the insurance is not going to cover it, if there's no pay source, we do have walk-in STD clinic at the health department, and we can send that to the state lab. The issue is it can take up to 2 weeks for us to get those results back. So if it's somebody who's symptomatic, please make sure that they're covered. And in speaking to the congenital syphilis, if a woman miscarries and she has a positive syphilis, that is considered a congenital syphilis case. That stillborn is considered a congenital syphilis case. I think that's all I have. Dr. Lowry, do you have anything to add?
Thanks, Tracy. I appreciate that, and I appreciate you answering the questions. I was just thinking that we are charged with doing chlamydia and GC screenings, to meet all these criteria for insurances, like Medicaid, and it's a screening. So we actually do that on every patient over 16, and we've caught a lot of positives on folks who had said they weren't sexually active. So we had to kind of backtrack that again. So it is a screening, right? So I didn't know, we do have, when we're having symptomatic children that have been sexually active, it's a no-brainer to go ahead and check the HIV, the whole panel, Hep C and syphilis. But I was just wondering if we do for a well visit, if that would prove us to maybe catch some of these older adolescents so that we can prevent some of this if we just went ahead and did the blood work. Thank you for helping me.
Thank you. And like I said, especially with your females who could become pregnant. Nobody thinks that they've had sex with somebody who had syphilis or HIV. So, I work in a different environment as far as, our testing and our guidelines. So it's hard for me to speak to what you may be able to do in your office versus what the state charges us with doing in the STD clinic. But I always feel like more testing is better than less.